Hello everyone, welcome back to Medinare. In this video, let's discuss about burning mouth syndrome. The contents under which we're going to study this topic are introduction, the other names of burning mouth syndrome, the causes, clinical manifestations, laboratory findings, and the management of the same. So, what is actually burning mouth syndrome? Burning mouth syndrome refers specially to a burning pain involving the oral mucosa in the absence of either local pathology or any underlying medical causes. So, there won't be any underlying cause as such or any local pathology, and that is actually the definition or the defining term for the burning mouth syndrome. But there are many other oral mucosal diseases that cause burning sensation as a result of some local pathology underlying it. But according to this definition, the burning pain involving the oral mucosa in the absence of either local pathology or any underlying medical causes. We have got a bunch of other names for burning mouth syndrome, which goes like stomatodynia, burning tongue, stomatoparesis, glossopyresis, glossodynia, idiopathic glossodynia, burning lip syndrome, and scaled mouth syndrome. Stomato is actually mouth and glosso refers to tongue. Okay, so these are the other names for burning mouth syndrome. Now let's look at the causes of burning mouth syndrome. So, according to the causes, the burning mouth syndrome can be classified as primary and secondary. In primary burning mouth syndrome, we won't be able to find any clinical or lab abnormalities, so that there is no underlying medical cause is detected. Whereas in secondary burning mouth syndrome, we have some underlying causes like dry mouth, oral thrush, certain nutritional deficiencies like iron deficiency, vitamin B12 deficiency, and denture wearers, gastroesophageal reflux disease, oral mucosal lesions, candidiasis, and people with salivary gland disorders, and hypertensive patients who are under the medication like AC inhibitors definitely will complain of burning mouth. It is also found that burning mouth syndrome is associated with some psychological disorders, particularly depression and anxiety. Then, moving on to the clinical manifestations of burning mouth syndrome, the most common site involved is the anterior two-third or tip of the tongue, the dorsal surface of the tongue, and the lateral border of the tongue. It also involves lip and anterior palate. As you can see in this picture, it involves the anterior two-thirds of the tongue and also the lateral border of the tongue. It also affects the lips and anterior palate. We have seen the most common site involved, and now let's look at what actually the patient manifests with. They manifest with pain, which is described as follows. The type of pain the patient complains of is burning, hot, itching type of pain, which often also manifest with that tingling sensation which they find annoying and very uncomfortable. And the nature of pain would be intermittent or constant. It would be for a long standing duration, and the intensity would be mild to severe, and the intensity would increase day to day, and it would increase towards the end of the day. And there are certain aggravating factors for the pain, which are the personal stressors, because as I before mentioned that there are certain psychological factors which are involved in the etiology of burning mouth syndrome. So therefore the personal stressors can aggravate the burning mouth syndrome, the burning pain sensation, and fatigue, and some specific foods like your acidic food, alcoholic beverages, etc. can aggravate your pain sensation. The burning sensation is relieved by eating cold items like ice creams, and by drinking cold drinks, and by placing candy or chewing gums. Paresthesia, dysesthesia or altered taste sensation like metallic, bitter or foul taste. Then patient complains of dry mouth, which are some of the other clinical manifestations of burning mouth syndrome. Along with this, Patient also complains of decreased appetite, poor sleep quality, and loss of interest in daily activities, which are suggestive of the psychologically affected problem like depression. Now let's look at the laboratory findings. Actually, laboratory studies should be reviewed in order to rule out an underlying systemic cause of the burning. So a clinician should check complete blood count with the differential, also fasting blood glucose level, hemoglobin A1C, iron, vitamin B12 and folic acid. Now let's move on to the management of BMS. We have certain pharmacological and non-pharmacological management. Under pharmacological management, topical clonazepam of dosage 0.5 mg per day is suggested. But these drugs have potential side effects including xerostomia, lethargy, spasmophilia, euphoria, and the risk of dependence. When you give clonazepam systemically, it carries additional risk of memory and cognitive impairment. Along with that, many other drugs like pregabalin, histamine receptor agonists like lafotidine, and other anxiolytics, chlordiazepoxide, diazepam, and dopamine agonists like levodopa and pramipexole, and medication which can be used topically like capsaicin, which depletes substance P to desensitize pain response. And there are certain non-pharmacological management like cognitive behavioral therapy, psychotherapy, exercise regimens, yoga, and acupuncture. And that brings us to the end of the video. I hope you guys found this video helpful. Thank you for watching.